Good morning, everyone. I'm Josh Telfer. I work at Physical St. Peter's at 231 Salt Lick Road in St. Peters, Missouri, and I wanted to talk to you today about the importance of fall prevention and why it's so important. So there will be a brief introduction. I'll talk about why falls matter, what causes falls, prevention strategies, and how physical therapy helps. In this presentation, I don't want to get too in-depth into the treatments, but just want to talk about the importance of fall prevention, why it matters. And here's my credentials: Master of Public Health, licensed physical therapist, and I have a Bachelor's of Exercise Science as well. And I treat vestibular and balance issues a lot here at Physical in St. Peter's, but also am certified to treat swelling, lymphedema, and I'm a certified clinical instructor, and I do treat orthopedic injuries, and I've worked in hospitals. Most of my experience is in outpatient and inpatient orthopedics, but I'm really enjoying digging into the vestibular system and exploring balance issues and how to resolve them. And my goal is to help you help yourself. I really like it when people are independent and can be autonomous, be able to move and explore the world independently. And so that's my goal, is to help people be able to do that. Why falls matter? So in short, the bottom line up front is that falls are an accidental injury. And accidental injuries, or unintentional injuries, are the third leading cause of death in the United States. So the number one is heart disease, number two is cancer. And if you're interested in exploring these causes of death and how to prevent them, I have other presentations that I've done that talk about healthy habits and the importance of healthy lifestyle and how to prevent some of these causes of death, or to do your best to prevent them. We can't always, unfortunately, prevent these things from happening. But what I want to dive into right now is, why falls are a part of that unintentional injury category. So basically, that unintentional injury category includes three things: unintentional poisoning deaths, unintentional fall deaths, and motor vehicle traffic deaths. So when you look at this list, the breakdown, you can see that drug overdoses would be included under unintentional poisoning deaths, and that leads this category with 100,000. But you look at unintentional fall deaths and motor vehicle traffic deaths, and that is surprising. I mean, I probably would not have put falls above motor vehicle accidents in causes of death, but there are more deaths due to falls, at least in 2020. This is data from 2023. So I have two pieces of data on the slide. The data on the left is from 2023, and it's the most recent available data to my knowledge, currently in the beginning of 2026. Hopefully we'll get the 2024 data soon from the Center for Disease Control and Prevention. But you can see that 47,000 people died of unintentional fall deaths in 2023. And the figure on the right side of this slide is talking about the years of potential life lost due to this category of unintentional injury deaths. So what this is showing you is that heart disease and cancer, they kill more people. That's the number one cause of death, is heart disease in the United States. The number two is cancer. So they kill more people than unintentional injuries. However, if you're looking at the age of these categories, unintentional injuries kill much younger people. So that means that if we're trying to estimate how many years of life are being lost due to these causes of death, unintentional injuries kills much more, or takes away many more years than these other categories. So this is always an estimate because we can't know how long somebody would have lived if they did not die from a fall or a motor vehicle accident or a drug overdose. But this shows the tragic nature of unintentional injuries because, as I would assume, if you're, I would assume all of us kind of intuitively understand the idea of triage, of trying to, number one, look at how serious somebody's condition is and if they can be saved through a healthcare intervention or some type of health intervention. And then number two, how old they are, right? So a lot of us would prioritize saving kids over saving our kids over saving our grandparents. And that's not something you want to choose, obviously, and fortunately we don't have to choose a lot of times, but that's what this figure on the right is trying to capture. This idea that if somebody dies at a younger age, there's a lot more lost, we would assume. So if that person had lived their whole full life. So that shows that the tragic nature of these deaths, and I'm not going to go into all the causes of death from unintentional injuries. I want to focus in on falls. And so if we see this figure is from 2020, and it shows that there were 72,000 years of potential life lost due to falls in 2020. And while this is dealing with an older age group, it is nonetheless extremely important to prevent deaths of people who are falling. Most people who are falling are older adults, and we want older adults to be able to invest in the younger generation, to share their wisdom. We love our older adults, our grandparents, and our elders, so we don't want this to be, we don't want those years to be lost, because that's going to be tragic, not only for the person who's suffering the fall, but also for all their loved ones that they were investing in. So why falls matter? 1 in 4 aged 65 plus fall each year, and less than half report it to their physicians. So there's a lot of falls, a lot of unreported falls, and every 11 seconds someone's treated in an emergency room for a fall. Every 19 minutes an older adult dies from a fall-related injury. And the cost, the financial cost is a big deal. So if you're looking at, healthcare access and healthcare utilization, a lot of older adults are going to be accessing and using healthcare more frequently than young adults. So when you see this $67.7 billion in combined medical costs are associated with falls in older adults every year, it's a lot of money. So if we could prevent the fall, because it's going to be more expensive to basically care for somebody who's had a serious accident due to a fall. Somebody's hospitalized due to a fall, it's much more expensive than seeking care to prevent a fall, right? So if we can prevent falls, we're saving money. We're saving healthcare dollars, we're saving Medicare dollars, we're saving taxpayer dollars. So we're keeping the health insurance companies happier too. And we're keeping the people happier that obviously don't have to deal with a hospitalization. So that's the goal. Falls are the leading cause of both fatal and non-fatal injuries in older adults. So 50% of older adults develop a fear of falling. And this fear of falling is something I talk with my patients a lot about, because basically what happens once you're afraid of falling, you tend to avoid certain movements or certain activities, which then cascades and creates a more dramatic fear of falling, a more sedentary lifestyle, which then causes more muscle weakness, more imbalance, because you're not utilizing the systems that you need to move and to stand up and to balance. So you increase your sitting time, which further weakens the muscles, degenerates or deconditions your body and your balance systems, and it's a cascade. So we want to avoid that cascade because that ultimately leads to a sedentary lifestyle and to a higher risk of falls. And the ultimate thing we're trying to avoid is disability and death. So when we're looking at some of the statistics here, this graphic is from 2020 as well. So you see that in 2020, 14 million, or 27.6% of older adults reported falling during the previous year. In 2021, 38,742, or 78 per 100,000 population, older adults died as a result of unintentional falls. So that data, 38,000, or approximately almost 39,000, that's from 2021. And we saw in the last slide, that's already up to 47,000 in 2023. So we have a higher number of people dying from falls. And part of that has to do with the demographics of our population in the United States, because our baby boomer generation, all the children that were born when the greatest generation was coming back, or so-called greatest generation was coming back from World War II. So that generation started having a lot of babies at that time, and so we have a higher population in that generation, and that generation is getting to the age where they're going to be at a higher risk for falls. So that could be one big reason why the number of deaths due to falls is going up. And it's another big reason why we need to try to prevent deaths due to falls, because we want to preserve that knowledge, expertise, and wisdom that we're gaining from the baby boomer generation. And that's an economic view of it, but the practical view of it is we love our grandparents and parents, and we want to keep them alive and well. So the challenge is to try to lower that total death number, even though there's a greater population in the age group that's at highest risk for falls. So to show you a little bit of the kind of geospatial aspect of falls, this is just a map that shows you the percentage of people reporting falls, and then the fall death rates per 100,000 adults. So the blue is the percentage of people reporting falls in the darker states. If you see your state in dark blue, that means that more people report falls in that state. It could also mean that there are more falls in that state, but that's more speculative. This data is telling us basically that more people are reporting that they fell in these states. And Missouri is listed there, and that's where I live and practice. That's where our clinic is, in St. Peters, Missouri. We also see the number of the death rates per 100,000 adults. And the darker the state, the higher the death rate. So one thing that you notice about these maps is that there tends to be a higher death rate in some of the northern states. And that could be because of those longer winters. Then you also see, it appears that West Virginia, Oklahoma, and Kansas have some higher death rates, Colorado and Utah. I'm not sure exactly why that could be either, just speculating here on the northern aspect of some of these states, the longer winters, maybe more snow and ice, more hazardous conditions. It could also be the rural aspect of some of these states. If it's harder to, get to care, if you're more likely to not be able to contact somebody if you've fallen and you can't get up and you can't contact a family member or call an ambulance, it could be that the rural aspect of some of these states is also leading to a higher death rate. So we want to, lower that, and we want to help you not be afraid of falling and not being able to access the care that you need. So, what are the most common outcomes of a fall? What's the real world impact? Obviously, loss of independence, more disability. Hip fractures can be very lethal. Once you're hospitalized and bedbound, you're more likely to get pneumonia or a respiratory illness that can kill you. So we want to avoid that type of immobility, especially for older adults, because we know older adults are more vulnerable to infections and to dying of a respiratory illness. So financial impact, we talked about, and development of comorbidities. I mean, this is important. So my personal experience, I had a grandparent who was, doing pretty well for his age. He was 90, I think 1 or 92, and he had an issue with his hip. He actually didn't fall, but he had what's called necrosis of the head of his hip, and that caused him to get a hip replacement. So, and he was more likely to, and I'm sure he had falls, but the cause of his issue was not a fall. What ended up happening, though, is after he had a hip replacement, he just didn't recover as well for whatever reason. And part of that may have been because the bone had already been deteriorating. But when you have a fall, you risk that you will not recover to the level that you were at before your fall. So what we want to do is do interventions that are planned before the unplanned, fall or injury. And that typically, when we can plan things out, we can typically get better outcomes if we're saying, okay, here's what we're going to do. We're going to have this rehab program. We're going to do this outpatient surgery and then this rehab program. We're going to do a prehab. We're going to do exercises and activities before your surgery to prepare you for that surgery. That's going to also help you. And then after your surgery, you're also going to do rehab. That's putting a lot of effort into a well thought out, well planned intervention to try to prevent a fall. So that is what happens with joint replacements. That process is the ideal process for a joint replacement, and that happens commonly across the United States every year. Thousands of people go in for joint replacements and have good outcomes. And people like me and your orthopedic surgeons are doing the best to try to make sure you have a good outcome from those types of surgeries. Having a planned surgery like that, I would prefer that to having an unplanned one, because you don't know if you have a fall, you got to get into emergency surgery. There's just less ability to really plan out your program and execute that in a way that you feel is best for your lifestyle and give you the best outcome from your rehab. So that's a little bit of the process that I think about when I'm trying to help patients prevent their loss of independence and prevent the development of comorbidities due to falls. So the psychological component of fear of falling is really big too. This is it's not just one thing in physical therapy. That's one thing I try to talk to my patients a lot about, is that, it's not just about your strength. It's also about your range of motion. It's not just about your ability to, feel your feet with your balance, because that's important. Neuropathy, which is common among some of the older adult population, can cause you to have worse balance. Poor eyesight can cause you to have worse balance. And then the vestibular system, if your vestibular system is not operating well, that can cause you to have worse balance. So it's not just one thing, and when you come into therapy, my goal is to try to test your different systems and try to find the system that's causing the most issues and work on that one. But also what I want to do is try to use your systems that are operating well to help you be safer, to help like lift up those other systems and help them to perform better. So what causes falls? After all that talk about the tragedy of falls and how they cause so many deaths and disability issues, now we want to talk about the cause of falls. So falls are not an inevitable or normal part of aging. If we get old enough, we're going to get osteoarthritis. We're going to have more pain. And everybody is mortal, so there will become a time when we have to pass away. Ideally, humans live a healthy life into their 90s. And, the most fortunate of us will live with a, good brain and mobility all the way over 100, right? That's kind of like the dream for a lot of people. Some people don't want to live that long. Some people want to live into their hundreds and be able to walk and move and communicate well and have a great lifestyle and spend time with their family and enjoy life. So most of us will pass away in our 70s or 80s, and that's lucky. It's not like that in many countries. In the United States, and I don't say it may not be most of us. Many of us may pass away in our 60s, but in the United States, the average length of life is in the 70s. So you're looking at 60s, 70s, 80s, most likely. And what my goal is as a physical therapist is to really realize the highest quality of life, not only the quantity, but the highest quality of life for people as they get older. So some people prioritize quality of life over quantity, and other people prioritize quantity over quality. But I'm greedy. I want both. So one of my goals is to try to prevent falls for people as they age and, realize the fact that you do not have to fall as you get older. And there's a lot of ways to prevent falls, which we're not going to get into in this presentation as much, but through talking about the causes of falls, you can intuit some of the ways to prevent them. So the physical factors, we talked about I just talked about those with neuropathy and your vestibular system, your eyesight, your ability to feel your feet, your hands, and muscle strength and flexibility. The medical and medication factors, so side effects are a very important thing to talk about with your doctors. Make sure that if you have questions about your medications, you can look them up online. It's very easy to find potential side effects. Talk with your doctors about potential interactions between your medications too. And, the doctors are usually on top of this, but if you have a concern, if you're noticing a symptom, it's very important that you communicate these things to your doctors, and instead of just continuing to take a medication that you feel could be causing an issue. So you want to talk with your doctors about these things, because your doctors often need your input to understand how to best prescribe the medications that you're taking. Environmental factors. So this is a big topic. When we talk about internal factors, we're talking about, what's inside your body. What's your body system doing to either help you be balanced or to worsen your balance. Those are the physical factors. Medication would be, more of a diet factor, more of like a behavioral factor, because all foods are drugs, and a pill is technically a food or a drug that you're consuming to try to help your body be healthier, right? So we want to put good things into our body, and we need our doctor's help and our physician's help, the nurse practitioners, the nurses who administer medications while we're in hospital, and physician's assistants, and other doctors and medical professionals. So we need their help to help us know what medications are best. Environmental factors, though, that's an important thing because we're talking about external factors that are contributing to your balance. So if you have throw rugs in your house, very common to talk about this, but a lot of people ignore these factors until they have a fall, which is unfortunate. So if you're tripping over things in your house, if you have a lot of clutter in your house, don't wait until you have a fall. Like if you're tripping, your body is warning you, you're losing your balance because of an object, or because when you get up to go to the bathroom, you have, you don't have a nightlight, or you have too many things in your room in your way, or you don't have a clear path to the bathroom. So there's lots of issues and cords throughout the house. So basically you want to clear all clutter, you want to clear the throw rugs, especially if you're having any difficulty navigating your house. If you're finding that you're tripping over things, that your toes catch on objects, that's a warning sign, and it's best to heed it. So try to always identify it, and this is what I do as a physical therapist, but a lot of people don't do it for themselves. Identify what's causing your fall if you can. Try to figure out what am I doing when I trip, or what am I doing when I lose my balance. And little losses of balance are the things you should write down or troubleshoot and try to figure out, okay, I tripped the other day. Why did I trip? Or I stumbled the other day. Why did I stumble? Was I lightheaded? Was I dizzy? Did my toe catch on something? Which foot was it? Was it my right foot or my left foot? That's what I do as a physical therapist. I try to break that down and figure out what muscle or system in your body or organ could be causing, this issue. So it can have to do with lightheadedness because of, a heart condition. It can have to do with deconditioning of a muscle. Maybe you're losing range of motion in your ankles, or your ankles are getting weaker. It can have to do with vertigo symptoms, which are a very common thing as people get older, but tends to be more transitory. It happens and then it goes away over time for a lot of people. So it's not always something that people get addressed. Sometimes they just wait for it to go away instead of seeking care. But if that's something that's going to recur, we want to know about it, and we want to try to address it and better condition the vestibular system to prevent falls. And then the last thing listed here is behavioral lifestyle factors. So this is a great one because a lot of patients do multitask. We are a society that moves very quickly. Whether we're just trying to drive to an event, or we're trying to navigate an airport, or you can even be just at the store, trying to get your groceries and get out of the store. The sedentary lifestyle is a huge problem. That's lack of physical activity and poor nutrition, alcohol consumption, and other unhealthy behaviors. So if you're more interested in figuring out how to prevent sedentary lifestyle, poor nutrition, excess alcohol consumption, I have another presentation on this YouTube channel, our YouTube channel at Physical St. Peter's, and we're happy to have you access that and listen to that presentation to see if you can glean some good information out of that. So physical therapy plays an important role in helping identify these risk factors, and I would be happy to have you come in for a free 15-minute fall risk assessment. So what I do with that is I run you through some tests and try to see, hey, what's your fall risk? Is it low, medium, or high, and it's just an estimation of your fall risk. I mean, one huge thing that gives us a clue of what your fall risk is have you had a fall in the past year, 6 months, 3 months? If you've had a number of falls in the past 3 months, that's a good predictor of more falls, in the future. So that's one of the first questions I ask. It's an obvious question, but if you've had falls and you've been fortunate enough not to injure yourself seriously, don't wait and just keep. It's kind of like playing roulette. It's gambling. You're really gambling with your health. If you're having falls and not seeking to prevent them. So let's talk about prevention. So non-treatment solutions. So most falls are preventable. Fall prevention does not require complete overhaul. Little interventions can really help a lot. So I talked about this on the last slide, but loose rugs, electrical cords, clutter, you want to remove those. Make sure you have good lighting. Night lights are great. If you got to get up to go to the bathroom in the night, most people do as we get older, especially. Non-slip surfaces and mats in the kitchen and bathroom settings, so that's really important. You can have grab bars in the shower. You can have a non-stick mat on the shower floor. You can have a shower chair if you fatigue from standing up or lose your balance when you close your eyes to wash your hair. That can also be an indication of a vestibular system issue. A lot of my patients who have difficulty balancing will get more dizzy when they close their eyes or feel more imbalanced when they close their eyes to wash their hair in the shower. Footwear is important. I don't like slippers and flip-flops. I don't like them at all for walking. If you have balance issues, that's not the footwear you should be choosing. So I don't like high heels either if you have balance issues. So most people tend to struggle with the slippers footwear in the house. So that can be really hazardous because, and it's not just that it might cause you to fall, but I don't like the way that people tend to shuffle their feet when they have slippers on, especially loose slippers that don't really hug the heel. And the reason for that is because people tend to leave their toes down, because if they bring their toes up and they take a big step, that slipper can start to slide off when they extend their knee, and it can actually kick it off their foot. So it trains you. Slippers can train you, and it's not the slippers with the that wrap around the back of your heel and are nice and snug, right? They're the slip-on slippers that just have, the toe box. Those are terrible because it's training you to shuffle your feet. So I would highly discourage you from using those, because that's just going to decondition your ankles over time. So mobility aids, canes, walkers, and grabbers should be fitted, and use of these devices should be, prescribed or fitted by a trained health professional. So you want to make sure that you're using these assistive devices appropriately. One of the big challenges for me is to try to help patients not use an assistive device that's too restrictive, but also not to use nothing if they need one, right? So the big clue that you need in an assistive device is if you're limping habitually, or you have what we call an asymmetrical gait or walk. So if you're limping a lot and you have pain, especially with it, that's an indicator that you may need an assistive device. And you may not need one for a long period of time. We see this in younger people all the time. A high school athlete sprains an ankle, they get on crutches, they rehab, they get off crutches, right? But what we don't want, a lot of older people can be afraid of getting an assistive device because they are worried about being more restricted to that assistive device for a long period of time. So FYZICAL can help you with fall prevention. We do it by giving you a fall risk assessment, by doing tests that test not only your muscle strength and range of motion, but also your sensation, your ability to feel, light touch. We can test other stimuli as well. And then we also test your vestibular system. How is it performing? How is your vestibular ocular reflex? Is it is it a hypofunction? Is it slow to react, or is it operating normally? So what we're doing is trying to determine how your systems of balance are performing. How is the integrity of your ligaments? We can test your ligamentous structures to see if you have perhaps a ligamentous injury. We can test the laxity of your joints. So these types of tests that we bring to the table, including at FYZICAL, we have the FYZICAL goggles that allow us to observe your eyes more closely to better determine and also record for data purposes so that we can send it to others. We can send it to you via email. We can send it to other practitioners within our system to try to get feedback on whether or not we're actually seeing a sign or symptom of a specific problem that we can address. So these goggles are infrared, and they basically just film your eye in the dark. And what that helps us do is better see nystagmus and other abnormal eye movements when we do various tests with those goggles on the patient. So those infrared goggles are one of the big tools. Another big tool is our overhead system, which is attached to the ceiling and graded for 500 pounds. We have a 20-foot system here in St. Peter's that you can walk in. That's very useful and helps reduce your fall risk. So we have, you can do a 20-foot back and forth, which allows you to actually do a whole lot of strengthening activities, stairs, obstacles, getting to and from a curb, if you have difficulties with curbs, testing various external aids like assistive devices, canes, walkers, and doing various other activities, balancing with your feet together, balancing in tandem stance, balancing with in single leg stance with only one leg on one leg. So balancing with your eyes closed. So those are a lot of things we do. We also have a New Balance shuttle balance system that we can use here. We have virtual reality goggles that we use just to play different videos to challenge you to balance, even though your visual system is giving you different stimuli. And those tools allow us to better help you determine, do you need a better external aid, and what are your internal strategies? Are your internal strategies, which of your internal strategies for balance are weak? Whether it's your muscle strength, your range of motion, your joint integrity, your proprioception, or we have your ability to feel, your ability to see, and your ability to sense where your head is in space. So touch, that's your somatosensory system, and that's often damaged with neuropathy. Your vision, it tends to get worse as we get older. That's something we heavily rely on for our balance. So you want to make sure your prescriptions for glasses or contact lenses are up to date, and you want to make sure that you've had an eye exam if you haven't had one before. Maybe you need one if you're struggling with your eyesight. So, and then the last piece of that kind of three-footed stool is the vestibular system, which allows us to sense where our head is in space, and if it's not operating correctly, then we really have a lot of problems when we start to close our eyes and move our head, because we take away the sensation or the information that we're receiving from our vision. And then on top of that, if you close your eyes and you turn your head and you start to lose your balance, on top of that, which will something that will load your vestibular system even more, is if you have a narrower base of support. If you're standing on a grass or some other uneven surface. That's going to really make your vestibular system work harder if you then close your eyes and start to turn your head. So a lot of education around the vestibular system is around those subjects, because we close our eyes when we go to wash our hair when we're taking a shower. We close our eyes when we blink, and we have to blink. So, if you happen to close your eyes at the wrong moment when you're walking or moving through your environment, it can really throw your balance off if your vestibular system is not prepared to deal with that change of sensation and information that you're receiving from your body. So that's a little bit of why we are doing what we do, why physical therapists are heavily relied on for fall prevention. So please let us know if you have any questions. You can come into Physical St. Peter's at any time to get a free 15-minute fall risk assessment screening, and we would love to have you come in just for a 60-minute evaluation. So if you are doing cash-based, our initial price for initial evaluation is $125, and our price for follow-up is $95. So I think either $90 or $95. So your insurance should cover the cost of your care. Whatever you usually do as a copay for physical therapy, if you haven't had physical therapy, you can look it up. You might have a copay, but your insurance should cover all that cost. If you don't currently have insurance, or you are being seen by another physical therapist, but you want to come and have a full evaluation here at Physical, and your insurance won't cover it, then you would be looking at the cash-based prices. But for the most part, if you have not had physical therapy recently, or if you haven't met your quota for the year, which most people haven't, most people will just have to pay a copay and have a certain amount of hours of therapy that they can receive each year and have not met that threshold. So come on in and we'll talk with you. We'll get your insurance card. We can do the 15-minute fall risk assessment screening, which is free. And then we can just quote you a price on, what your insurance would cover. We call your insurance and we say, hey, what do you cover for this patient? They give us what they would cover, what the copay would be, and usually it's they totally cover care or there's a copay. Those are the two situations that we encounter most often. If for whatever reason we aren't in network with your insurance, or your insurance is refusing to cover because you've met the threshold for the year, the cash-based option is always an option. So, and to get, I'm happy to try to give you as much information in that first evaluation as I can, and email you the report of your comprehensive evaluation. It's one of my favorite things, is to try to really test people and see what their strengths and their weaknesses are, and then give them a plan to work on their weaknesses but embrace their strengths. And that's something that I'm continually trying to refine, like every day here at Physical, and in my own life. I want to better identify people's strengths so that I can encourage their strengths. That's something called strengths-based psychology or positive psychology. That was a movement in education and academia, and even organizations like Gallup, the ones that do, I think, the polls. They also have the Gallup Strengths Assessment, Gallup Strengths Finder, which are very useful. So I like to take that attitude towards physical therapy as well. Really focus on, hey, let's look at what's strong as well, not just as what's weak. And I think that's something that can really help revolutionize care and encourage patients to achieve their best outcomes. It's something that I have not even, I think, scratched the surface of yet, because it's something that if we really do that in physical therapy, I think it would change, kind of give us a 50%, of potential, for the patient. Like, we're looking at weaknesses a lot, but if we look at strengths, what will that unlock? So, give us a shot here at Physical St. Peter's. Come on in, get your free fall risk assessment, and then we'll let you know if you can, if what your insurance covers, and then you can decide if you want to come in for a full evaluation. It's a really good deal, and we're here and we're available. And if you don't utilize us as a resource, we may not be here forever. So come and utilize us, and you're going to be. We're going to help you to improve your balance and love your life. Presentation, folks. If you have not had an evaluation by a physical therapist in your lifetime, or haven't had one recently, I would highly encourage it, especially if you're getting up in age, if you're over the age of 65, if you're struggling with any part of your balance, if you notice a regression in your physical abilities and capabilities. Because muscle testing, if you've never had your muscles tested by a practitioner, range of motion testing, if no one's ever used a goniometer to measure your joint range of motion, those are very simple tests all physical therapists do. Then we can step it up to a foot screen and vestibular testing with infrared oculography. And then we can step it up to balance testing and more comprehensive assessments. So there's lots of things we can do, lots of tests we can provide. We also have a foot screen here at Physical that we can provide to you to see how you're walking, what your gait looks like as you step through one step. And there's lots of other tests that I haven't mentioned. If you're having knee pain, if you're having joint pain, can test the ligamentous structures, can test the mobility of the joint, see how much laxity is in the joint, how it feels, and palpation, feeling, where is the pain coming from. So we are detectives for the musculoskeletal system and also other systems of your body, and we try to figure out, hey, what's going wrong and how can we help? What external aids can we bring? We have a lot of tools and products that we can give to you, or you can purchase to help address your pain. So it's something that you don't have to be discouraged. You don't have to be to continue to be frustrated about your pain without knowing where to go. We're not always going to provide 100% resolution for everything, right? But what we can do is help you move to a better place. The goal is not to totally eradicate all the time. If we can, we want to totally eradicate your pain and disability. But our goal is also just to get what we can, take what the body can give us, and help improve your functional status and your ability to do what you want to do. If we can't get out and do a hike without an assistive device, can we get out and do a hike with some hiking sticks or a cane? These types of simple interventions, simple practical thinking is what physical therapists are really good at, what we practice doing all the time. So come into Physical St. Peter's for your free fall risk assessment or for an evaluation, and let us help you love your life. Have a good day.